Good morning, everybody, and welcome to this webinar by the MEP Interest Group on Diabetes called MEPs Mobilizing for Diabetes, which is hosted by its secretariat by the International Diabetes Federation Region Europe. My name is Bastian Haug. I'm a board member of IDF Europe and of the European Diabetes Forum, and I have the great honor of being the host today for the next hour. Today, we'll be launching and discussing the blueprint for action on diabetes in the European Union by 2030. This has been developed over the last couple of months. And before we start, we have a fully packed agenda with some amazing speakers. We will unfortunately not have a lot of time for live questions to be discussed because of the limited time. But what I would like to encourage everyone on this call, on this webinar to do is, I would like to encourage everyone to submit questions and comments in the chat, or comments that you have or thoughts you might have to this blueprint to mmd@idfeurope.org. MMD, that is the name of the MEP interest group, MEPs Mobilizing for Diabetes, mmd@idf-europe.org. So please send any questions, thoughts, comments by email later on or directly here in the chat, and we will make sure this reaches the whole MEP interest group. Now, without much ado, I would like to jump right in and hand over to Christel Schaldemose. She is one of the co-chairs of MMD of the MEP interest groups for her opening words. Christel, great to have you here again.
Thank you very much, Bastian, and good morning to every one of you. My name is Christel Schaldemose. I'm a member of the European Parliament representing the S&D group and elected in Denmark. I am, together with Sirpa Pietikäinen from EPP Group and Finland, co-chair of this MEPs Mobilising for Diabetes. We are an interest group here in the European Parliament, and we are interested in having higher level of awareness of diabetes. We need diabetes to come higher up on the agenda. Good morning and welcome to this webinar. It is now nearly 100 years ago the insulin was discovered, and that changed the lives of people with diabetes. However, it's 100 years ago, and we have seen other medical and technological advances, but that's not enough just to be better with the medicine and things like that. We also need to look at diabetes in another more holistic approach, because there are several challenges for people living with diabetes. We need, in fact, a new and holistic approach to diabetes. We need to address, of course, the illness. We need to look into prevention. We need to create better care, but we also need to address stigma and discrimination. And what we need is also to promote a person-centered, value-based and integrated care. That's a lot, but I think it is possible if we plan for it, if we wish to do it right, and if we push rightly in all the policy areas where there is an option to do so. And here in the Parliament is one of those places where we can do something. And together today, we're going to discuss this blueprint for action on diabetes in the EU by 2030. We have a lot of good ideas on how to tackle the challenges around diabetes, and we will hear some of them today. We need systematic changes in order to flatten the diabetes curve, but it is possible if we want to. And therefore, I think it is important that we also play a role as members of the European Parliament. So welcome to this very interesting webinar with a lot of very good and very clever speakers, and I'm really looking forward to learn more today. So welcome, and I'm looking forward to the discussion. On behalf of Sirpa Pietikäinen and me, we welcome every one of you, both people who are just participating, but also especially all the good speakers. Welcome, and back to you, Bastian.
Yes, thank you very much, Christel. And as IDF Europe is hosting this call today on behalf of the MEP interest group, and we represent the voices of people living with diabetes in Europe, more than 60 million very soon. We thought we would kick this off with a series of very, very short videos, 5 quick 1-minute videos of people that have been diagnosed with diabetes over the last couple of years. and this will hopefully make this a bit more people and persons centered.
Op mijn 50ste kreeg ik van de arbeidsgeneesheer te horen dat ik mijn levensstijl moest aanpassen. Ik was te zwaar, had een te hoge bloeddruk, mijn cholesterolwaarden waren te hoog, maar vooral mijn HbA1c ging de verkeerde kant op. Mijn huisarts nam een afwachtende houding aan en ik maakte mij geen zorgen. 5 jaar later kreeg ik via de arbeidsgeneesheer te horen dat ik in het stadium diabetes type 2 terecht was gekomen. Mijn huisarts schreef medicatie voor en ik dacht dat het probleem opgelost was. Toen maanden later echter bleek dat mijn bloedwaarden bleven stijgen, ben ik op zoek gegaan naar informatie. Ik kwam bij een specialist terecht en die heeft mijn medicatie aangepast, mij een ander voedingspatroon opgelegd en samen met beter en langer bewegen kwam al vrij snel een gunstig resultaat. Beter en sneller advies en goede opvolging hadden mij waarschijnlijk veel sneller op het goede pad gezet.
Hallo, ik ben Christel. Ik heb sinds 11 jaar type 2 diabetes. Die diagnose van diabetes kwam niet als een verrassing. Aangezien ik zelf in de gezondheidszorg werk, herkende ik de symptomen. Toch het verdikt te horen krijgen van je arts maakt toch wel wat enige emoties los. Mijn arts heeft me gewezen op de risicofactoren voor de toekomst toen ik de diagnose kreeg, en dit onverbloemd. Ik was blij dat ze heel eerlijk was, want door dit shock-effect ben ik wel meer op mijn levensstijl gaan passen. Ik kreeg voldoende ondersteuning, zowel van de arts als de diëtiste. Sinds een 2-tal jaar neem ik geen medicatie meer voor mijn diabetes, omdat ik aan sport doe en door te vermageren. Wat de beleidsmakers nog kunnen doen om het risico op type 2 diabetes te verlagen, is om een gezonde voeding goedkoper te maken dan fastfood. In drankautomaten water duidelijk goedkoper maken dan frisdrank. Met diabetes is zeker goed te leven als je je levensstijl aanpast.
Hi to everybody, my name is Richard Lobet. I'm 58 years old and I'm living in France. I'm Belgian. Since 2015, the year when I was kidney transplanted, I have been suffering from diabetes 2. That was just after the transplant, because I had to take a lot of medicine to help me to keep my kidney in place and sane. Since then, I've been treated with insulin injections 4 times a day. I've been more or less changing my diet, and it has been very difficult to keep my diabetes regular. It is often too high. Now I've been placed a device to control automatically my blood level, my sugar level, and trying to make the diabetes low. My dream is, of course, to have a treatment that keep my diabetes low and that I wouldn't have to take care of it. But it's not there yet. I have some difficulties to make it balanced.
Hi, I'm Janelle. I'm 22 and I'm here to talk about raising awareness about the subject of type 2 diabetes and prediabetes, as it is not often addressed, because people will know more of type 1 diabetes and they don't know that the type 2 can affect all ages and all metabolisms, whether people are thin or overweight. I have myself been diagnosed of prediabetes when I was around 14, and I've been lucky to be helped by professionals and my surroundings, as it's often a genetic condition and some people of my family have experienced the same. And so I've been taking medication, natural supplements, and changing my eating habits for the past few years, which saved me from real diabetes.
My name is Chris. I'm from the UK. I'm 51 years old, and I've lived with type 1 diabetes since I was 26 years old, diagnosed in 1994. In 1994, there was no internet, so you couldn't go online and find people with diabetes to talk to, and I wasn't aware of any local groups. However, I did work with someone who had type 1. In fact, I sat next to them at work, and I was getting peer support from day one. I didn't actually realize it until I finished work, moved job, and then didn't have that person to talk to and didn't have anyone just to chat with, really. Peer support is absolutely vital. It's not something that is a nice to have. I think everyone with diabetes should be told about peer support and the online communities that are now available as soon as they're diagnosed. They can make up their mind who and where they want to talk to people and when, but they need to know that help is out there for people that understand the condition that they are now living with.
Hello. Hi, everyone. Could we have the slides up, please, Elizabeth?
Niti, the slides are coming afterwards.
Okay.
Currently, it's just a quick feedback on the videos and the...
Okay, great. Thank you. Thank you for reminding me. Hello, everyone. I'm Dr. Niti Paul, and I am the president of the International Diabetes Federation for Europe. And my journey with diabetes is also very personal, as you heard in the videos. I have a son with type 1 diabetes, and he's had it for 27 years now. And we as a family have lived with this condition for many, many, many years. I welcome you all to this lovely webinar on the launch of our blueprint for EU for diabetes. I'm very, very grateful to our two co-chairs, Sirpa and Christelle, for being here and for supporting us all the way, and for all of the others who are on the call today. And for all the people with diabetes that have lived with this condition for many, many years. As Bastian said, we are the voice of people with diabetes, and that's what we hope to represent today. So thank you very much for being here. You heard the perspectives, you heard from people with diabetes, both type 1 and type 2. I hope you've understood that this is a very multifactorial illness. It's not just because you're overweight, you get the illness. You can be of any size or shape. There is genetic predisposition, there is environmental predisposition. So it's really, really hard when people say, oh, it's your fault that you've got diabetes. It certainly isn't. And that's what we're trying to show you here. To manage the condition requires health professionals to work alongside of patients with peer support groups involved. So, and lifelong education and training. So we do hope that the people with diabetes have demonstrated that. And we hope that this EU blueprint for diabetes will help us reach that goal of supporting people with diabetes to live happy, healthy lives, but also making sure that there are no inequalities across Europe, which is what we're trying to achieve. So I thank you again for coming to this webinar, and we'll talk more about the blueprint in a few minutes.
Yes, thank you, Niti, and thank you everybody for watching. For also me personal, I've lived with diabetes for way over 20 years. I think it is very important that we always open even these high level, or especially these kind of high level webinars and meetings with people living with diabetes who share their voice. But now it is our great honor to start and kick this off with a greeting from the Ministry of Health from Portugal, Dr. Marta Tenido.
Diabetes is a major public health problem in Europe. Some 32 million people in the European Union live with diabetes, and this number continues to rise and will reach 38 million by 2030. This has a major impact in the quality of life of our citizens and represents a major burden to health systems in the EU. Thus, initiatives like the Blueprint for Action on Diabetes in the European Union by 2030 are welcome in order to empower our efforts to tackle this problem. This initiative, created by members of the European Parliament, intends to elevate diabetes on the EU political agenda and to foster policy measures and action through close collaboration with the EU institutions and member states. In that sense, the Portuguese presidency of the Council of the EU strongly supports the objectives of this initiative. In fact, the blueprint outlines measure actions to be implemented in the next 10 years, and those actions pose pivotal challenges that can only be successfully achieved by involving governments, institutions, but most of all patients and their families and caretakers. Key policy actions are needed to tackle the diabetes challenge in the EU in time to meet the 2030 Sustainable Development Goals. These policy actions must focus on reducing the risk of developing diabetes, improving access to quality care, and integrating care for all citizens with non-communicable diseases, including diabetes. In that regard, it is important to highlight the focus on mental health, as diabetes has an enormous impact on mental health of people living with this condition. Therefore, access to adequate psychological support must be integrated as a key component of diabetes care. Research and innovation, so important in the recent months to accelerate the global response to the pandemic, also plays a major role for improving diabetes prevention and management. Diabetes alone or in the context of broader research on non-communicable diseases must be part of all key EU-funded research programs. Diabetes is, as we are all aware, a major risk for several non-communicable diseases, such as cancer or cardiovascular diseases, which are the major causes of death in the EU. Therefore, researchers, universities, but also people living with comorbidities have a crucial role to play in improving our knowledge and contributing for better health care in the near future. Diabetes is a major public health problem in the EU, and it is our duty to unite efforts to respond to it, like we have done in the past months in response to the COVID-19 pandemic.
So, on behalf of the EU presidency by Portugal, this was Dr. Marta Temido, the Minister of Health from Portugal. It is now my great honor to welcome Cristian Busoy. He's an MEP from Romania, but most of all, he's the rapporteur for the EU for Health program. Cristian, you've immediately agreed positively to our call to please join the MMD group, the MEP interest group on diabetes. Thank you very much for that. And please give us your perspective on diabetes as a health priority in the European Union, and from that perspective as being the rapporteur for EU for Health. Cristian.
Thank you so much. Good morning. Okay, I have permission also to start my video. Thank you so much. I am very honored to be here today to support this important initiative. I would like to thank you for inviting me, and I really believe that the launch of the blueprint for action on diabetes in the European Union is extremely important. As you know already, as a direct consequence of COVID-19, the EU proposed its new standalone program, health program aimed at strengthening EU health and also healthcare workforce, including digital transformation, including increased use of e-health, mobile health, and telehealth in synergy with Horizon Europe and Digital Europe program, all instruments under the next MFF. You mentioned my quality as a rapporteur for this program. I'm also chair of Industry, Research and Energy Committee, and also in Horizon Europe in the research area, we could have many opportunities to improve the methods of diagnosis and also the treatments for patients with diabetes. But coming back to EU for Health, I would like to stress out that during the negotiations, the Parliament team, myself and the shadows from the other political groups, we have made everything possible so non-communicable diseases are integrated, and that the dimension of prevention and health promotion will benefit of at least 20% of the total budget. There is a need to increase the level of recognition of non-communicable diseases as a key health priority for the European Union. And the program will have as actions and objectives the followings: raising awareness, early diagnosis, health promotion, and the need for increased uptake of digital tools and services that enable prevention, treatment where suitable, monitoring, and also the continuity of care. The EU for Health program, in general terms, should make EU health systems more resilient, make them to communicate and to cooperate much better. Also, would like to make health systems to face current weaknesses, such as medicine shortages and addressing chronic diseases, strengthen our fight against cancer, but also support the health sector to go digital. Coming to this, it was my proposition to include and to support financially from you for health the development of electronic European health record that would provide healthcare systems with means to improve the availability and quality of healthcare and patients to get access to treatment more rapidly and easily. Also, we asked for the realization of different digital platforms in order to boost the coordination in the field of management of diseases such as diabetes, asked for guidelines for management of diseases in the area of both communicable and non-communicable diseases such as diabetes, asked the full implementation of European Reference Network, cross-border directive, and data sharing. I will end my speech by saying just a few words about innovation. Innovation in research, progress towards digitalization of the healthcare sector, improving health infrastructure by turning digital, will facilitate better healthcare and access to healthcare for our citizens foremost, and of course will make our healthcare more resilient. A growing number of digital programs and e-health tools are proven to improve health and lower the cost of care. Of course, we need synergies, we need concrete actions. We have at our disposal not only this centralized program, but also digital transformation of health and care in the digital single market, and we have Digital Europe. We have, of course, the cohesion funds for each member state, and their programs of early detection of prevention could be financed by European funds, but of course we have to advocate to each member state to include them, and of course we need to advocate for a better financing of health from the national budgets. With the high prevalence of patients suffering of diabetes, patients who use digital health technologies can benefit greatly from short-term health improvements and long-term health self-management. At the same time, healthcare landscape could also benefit out of digital health innovations in diabetes prevention too, and we have Horizon Europe, a EU for Health program for that. I wish you a lot of success in your events, in your initiatives. I congratulate my colleagues from European Parliament for being so active, Madam Schaldemose, Madam Pitekainen, and all the other colleagues for promoting the rights of patients with diabetes. And we are in the European Parliament a team of colleagues which will fight for these objectives. Thank you so much.
Thank you very much, Christian. MEP from Romania, Christian Busoy, the rapporteur for the EU for Health program. Christian, I understand that unfortunately you will not be able to stay on for the panel discussion, but thank you so much for taking the time for this quick introduction. And
thank you so much. This evening we have the great hearing with the pharma companies, the 7 CEOs with the vaccines, and I will have to go on live on BBC this morning. But it was my honor to be here with you, and I will stay a few more moments. Thank you
very much for taking the time. We would now like to really get into the subject matter and introduce the blueprint for diabetes in the European Union by 2030. And for that, I welcome again Dr. Niti Paul, the chair of the International Diabetes Federation here in Europe, who will introduce the key recommendations. And with her, alongside her, I introduce, and it's a great honor to have her here, Kajsa Lindberg. She has herself been living with diabetes for more than 18 years. She's been a long-term consultant to IDF Europe, but she has also consulted the European Diabetes Forum, the OECD, the World Health Organization, and the NCD Alliance. Kaisa, thank you very much for joining us. Kaisa will be introducing the enablers to reach those recommendations that Niti is now going to present. Niti, go ahead.
Thank you, Bastian. Thank you all for being here, and for Mr. Basoy, thank you for your participation and giving us so much support. We are really obliged to you, very, very, very obliged to you. We know you're a very busy man. The COVID pandemic has thrown everything into disarray across every country on the planet. So we recognize that your contribution to this means a lot to us. But just on that subject, really, what COVID-19 has also demonstrated to us is the huge health inequalities is exposed, the deep cracks in health inequalities is exposed across the European Union and across Europe and the world. And we know that people with diabetes have been more prone to getting the illness and from the increased mortality associated with the illness. So it's time for action. And we've done a COVID-19 survey, Mr. Basoy, across the European Union and across Europe. And we'd love to share that with you sometime to show you what that actually showed. I think it has lessons to be learned for a lot of long-term conditions, but also the way we handle pandemics for the future. And this is coming straight from patients and from consumers of service. So I'm sure it'll be of use to you all. Moving swiftly on to the topic in hand, which is the launch of the blueprint. I'd really like to thank all our partners who've helped make this happen. We'll acknowledge them at the end of this. We have a lot of corporate partners who've helped us, supported us through thick and thin, not influenced, but supported us to do this. And this has been a long time coming. We started a very long time ago with the St. Vincent Declaration, which was very, very long ago. But the St. Vincent Declaration has not realized what we expected it to realize up to now, is to get good, quick access, standardized care across Europe. But that was the nature, that's the nature of declarations. But it did help bring this to the political agenda. The WHO, FEND, we have our good friends from the European Nurses in Diabetes, and Felton's on the call, Euradia, PCDE, Primary Care Diabetes, the World Health Organization, we have Jill on the call here today, have all been looking and helping us, and the European Diabetes Association as well, helping us to get to this point. We started with influential MEPs at that time, and I can remember, I'm old enough to remember that. And we're really delighted to relaunch and rejuvenate and reinvigorate our group again. Next slide, please. So what is it that, how is it we got to this point? A lot of our blueprint is based on interviews with people with diabetes, which I think is the most important thing here to remember. This blueprint isn't coming from healthcare professionals. It's not coming from pharma companies. It's coming straight from the mouths of people with diabetes and how they wish to see their care. Interviews with IDF member associations. So all our member association, I can see lots of our friends, attendees on the call, lots of people from the Eastern European countries are out here. Elena, Valentina, all of you very welcome to this webinar. And we shared the concept with IDF Europe board. So I thank all my board members who've contributed to this. And then we got stakeholder feedback from all the folks that we've just spoken about. Next slide, please. Could we go to the next slide, please? Thank you. There are three pillars that we have put together in this blueprint. One is to reduce the risk of diabetes, whichever type. We're not specifying that. Two is integrate care for the patient. And this is with the patient at the center of this, not with the health system, not with everything else, not for the professional. This is for integrating care around the patient as they wish to see it, or the citizen, and enabling access. By access, I mean good quality access to the best possible treatments that give people the best value for money, health systems the best value for money, but also patients what they're seeking for in their care, which is patient-related outcome measures. And how we talk about this, that what underpins this is the engagement of patients with diabetes to actually drive this. Digitalization and data, we can talk about that in a minute. And Mr. Basoy spoke about that. Crystal spoke about that in her opening speech. And the research for actionable insights. In all my history, I'm a primary care physician, by the way, and in all my 35 years of general practice in the UK, I have searched for actionable insights that allow me to reach into the hardest to reach communities and what makes a difference to activate patient engagement and what helps deliver best possible care. And that's what we're trying to get at as well. Next slide, please. On the pillar 1 is raising awareness. This is reducing the risk. It's improving knowledge, tackling stigma, creating enabling environments for this to happen. So modifiable risk factors to be reduced and the social determinants of health to be addressed and the diabetogenic environments that we talk about. So more open spaces, more places for people to walk, more clean gyms and more areas in which people can exercise and good food and proper food labeling. Acting early for screening, early diagnosis, and stopping therapeutic inertia, which is one of our people or one of our folks on the video spoke about the GP taking it easy and people feeling complacent about starting treatment. So really starting to look at that early. Next slide. The second pillar is integrating care. And in all my history, it is really, really difficult to do this because health systems have a life of their own. But the one thing that does integrate care properly around the patient is having very strong primary care. And in systems where there are strong primary care systems, you will find that the care gets integrated more easily and there is more data available. Making the care patient-centered and looking at value-based care. So this is making sure that we're looking at measuring outcomes, not just for systems, not just for reducing the spend, but also looking at what matters to patients about their care. And better integration between all levels, so primary, secondary, tertiary, and community care, all integrating better with each other to provide a seamless care experience to patients. Moving on. And then the pillar 3 is enabling access. This is to reduce inequalities, and we've seen the devastating effect of this during the COVID pandemic. Investing in innovation as a support, innovation is not a cost. Digital therapeutics is now here to stay. The digital front door to healthcare is finally open. Providing adequate support, we talked about peer-to-peer support, very, very important. I know that my son, Bastian Kaisa, and a lot of others use their peers for their support to get to understand what the latest treatments are, what works for them, what doesn't work for them. And this includes psychological support. We've seen huge amounts of people at the moment suffering with stress and mental health issues as a result of the lockdowns that we've had in Europe, but also because of the added pressures of having to deal with a chronic illness and perhaps not the access that they were expecting in the past. Increasing literacy and ensuring no one is, you might think this is funny in Europe, but it's true. There are inequalities in health and digital literacy across Europe, and we're wanting to tackle this health divide by looking at how we get digital literacy up for our communities. Next, please. Can you?
Niti, I think this is Kaisa who is taking over right now.
Yeah, I was going to say that.
Thank you.
Over to you, Kaisa.
Thank you, Niti. Let me just see if I can get control of the slides, please. All right, so the 3 pillars that Niti just presented are in turn supported by the 3 following enablers. The first one is engagement of people living with diabetes. And on the slide, on this picture here, I see Urosh. If you can go back, please just present one of them. Thank you. In this picture, this is Urosh. He's not here on the call. He's a very powerful advocate and a friend and colleague of mine, so I'm happy to see him. Diabetes, I think we all know, is a lifelong and hugely complex condition. And while it is a chronic disease, like many others, the relentless self-management of diabetes is really like no other. It's a condition mostly managed by the people living with diabetes themselves, with actually quite little input from their healthcare professionals. We only see our doctors and nurses a couple of times per year at best. People living with diabetes therefore have to become experts in managing their conditions, and they should also be treated as experts. But too often we see decisions surrounding diabetes taking place without any true involvement of the people concerned. So there has to be meaningful involvement of people living with diabetes, not just in the day-to-day management of care, but also through participation in research projects, in risk reduction programs, in policy making, et cetera, as co-designers and as co-decision makers. Because people living with diabetes are best placed to determine what health outcomes matter most to them and what their unmet needs are. And as we say, nothing about us without us. The second enabler is data and digitalization. Anyone who lives with diabetes knows that it's a condition largely based on numbers and calculations and data. And today, technology and digitalization are natural tools in managing the condition. So diabetes therefore lends itself well to the setup of a framework to measure patient-driven health outcomes for both existing and novel interventions. By streamlining activities, by reducing waste and facilitating monitoring of the impact of interventions, broader data usage and digitalization opens the door to the deployment of the most advanced and innovative prevention and education initiatives and treatment and care practices. And if I could please get, yes, thank you. Increased digitalization, that's a tricky word, can also help improve the quality of life of people with diabetes. It can help reduce incidence of type 2, decrease the cost of healthcare expenditure, free up health system resources, and very importantly, broaden access to health. And what the recent COVID pandemic has also highlighted is the lack of standardized data collection and data sharing across EU member states. The lack of this hampers the development of a collective and a coordinated response across the Union. And it represents a major barrier to the development of more resilient health systems. Increased collection of personal data from devices like CGMs and the creation of European frameworks has the potential to bring real benefits, definitely, but they also raise a number of questions and challenges. And for the European health data space, it's essential that strong, transparent governance approach is promoted, one that includes all relevant stakeholders. And special attention also has to be given to ensuring ethical use of the data as well as the modalities of this usage. By whom, how, for what purpose, and with what implications. And also determination of its ownership. One example being in the context of user-generated data through CGMs. So at the EU level, diabetes would appear to be an obvious choice to be a flagship initiative of the European health data space. And the last vital enabler is the conduct of research for actionable insights. Research is, I think we all know, the cornerstone of future improvements in diabetes prevention and management. And again, in light of the recent pandemic that we're in, the COVID one that is, and the burden of diabetes across Europe, research has to be strengthened. Critical areas of research include the prevention of type 1, treatments addressing the destruction of insulin-producing cells or reversing insulin resistance, research into stigma and its impact on health outcomes, best practices and cost effectiveness of screening and reduction strategies, follow-up screening for women with gestational diabetes and children, evaluation of novel tools, technologies, and other areas of innovation. If I could get the next slide, please. So this was a fairly quick summary of the main recommendations in the blueprint, 3 pillars and 3 enablers, but the full document, the blueprint, also makes direct links to the different relevant EU programs and EU initiatives that can help implement these recommendations. And it also lists success measures and next steps. And if you'd like to have a closer look at this, the full blueprint can be found on the website of the MEPs Mobilising Diabetes Group. And as you can see, the address is on the slide. Oh, it just disappeared, but I think we'll write the address in the chat. Thank you for listening, and back to you, Bastian.
Thank you, Kaisa. An honor to have you here again. And thank you, of course, Dr. Niti Paul, for presenting what's in this massive blueprint, in this report on action on diabetes. With that, I would like to turn to the panel discussion. And I would like to start with Chantal Mathieu. She's the Senior Vice President of the European Association for the Study of Diabetes and the President of the European Diabetes Forum. Chantal, as a clinician also, I would like to ask you, out of everything that's in this report, how does it resonate to you? And a very mean question maybe, if you were to take just one of these many recommendations in there, which one would it be and why? Thank you for joining.
Yeah, again, as I put in the chat, I'm so proud also as chair of the European Diabetes Forum to be partnering with IDF Europe, because I do think the patient voice is central to everything, but it needs to be amplified and supported by the voices of all stakeholders, also the clinicians, as you say. And so as a clinician, again, it is it is really exciting to see that the people living with the disease are taking this to the forefront of our politicians. And so we hope to be collaborating on policy recommendations. Choosing, Bastian, is choosing between your children, and it's difficult to pick a favorite, but honestly, my favorite is the harnessing of the power of digitalization and data. Just to give you an example, what was said today, some people refer to 60 million people with diabetes in Europe, others to 30 or 38. Honestly, we don't know. So we need structured, organized registries in Europe, so that we can, with research on these registries, really come to good policy recommendations. And then, of course, digitalization. The fact that we have now new tools to help people live with diabetes in a better way, but also tools to communicate with each other. The fact that Chris was one of the witnesses today, he is the grumpy pumper on Twitter. I follow him. I know he has become a granddad. And all of that is so empowering and invigorating for people living with the disease, but also for clinicians, for researchers. So great initiative, and let's push this forward.
Thank you, Chantal. And I would now like to bring in a new speaker to leave a little bit the Just EU bubble and bring in Dr. Jill Farrington. She's the Regional Medical Officer for CVD and Diabetes at the World Health Organization, responsible for Europe. Jill, I'd like to ask you the same question. How does all of this, reading this report, how does this resonate to you and to your organization? Thank you for joining.
Thank you, Bastian, and thank you, colleagues. It's good to be with so many kind of friends and peers that we've been working with. And congratulations on the document, because I really like the holistic approach to it, and also the involvement of patients and the focus on outcomes which really matter to people with diabetes. I mean, it certainly resonates with our organization. As we've already heard, diabetes is one of the 4 major non-communicable diseases that we are trying to tackle within global health targets. But it's also an area of that we work directly with countries in technical support. It's part of an area that we try to improve care when we're working in health system strengthening, for example, in primary health care. It's a priority topic even within non-communicable diseases. So in the last year, we've been working on some of the areas which are in the blueprint. So we've been working on screening, improving the effectiveness of screening. We've issued a guide on diabetic retinopathy screening. We've been also working on using data to improve quality. And then there are sort of broader linkages. For example, we also have flagship programs on digital health and behavioral cultural insights, health literacy. So I think there's also opportunity for collaboration in implementation. And I see that in the chat, there was a question about how do we support countries outside the EU, and WHO Europe is covering all 53 member states. So there's complementarity, I think, in the work of this blueprint and the work that we can carry forward as well. Thanks.
Thank you, Jill. And please feel free to stay on this call, as this is supposed to turn into a panel despite we have little time. And Chantal, please also feel free to stay on with your camera on and jump in.
Thank you, my pleasure.
Turn to Jonna, but I think she's not here. So let me talk to Tobias Wiesenthal now. He's head of sector research and innovation in the unit responsible for e-health, well-being and aging at DG Connect. Tobias, are you here?
Yes, I'm here. Thank you very much.
Yes, wonderful. I would also like to ask you the same question. How does this resonate, but also specifically with your hat coming from the more digital space, because this is something that also was mentioned as one of the key enablers. Maybe you can talk a little bit about how you see digitalization and tools for people with diabetes help address these challenges and bring forward these recommendations.
Absolutely, with pleasure. And thank you very much for inviting us. First of all, congratulations. And also, we are very happy to see that the role of digital tools and of data has been so prominent in the blueprint and also in the previous contributions of the other speakers. I think it links very well to the Commission's commitment to the digital transformation of health and care that has the three overarching objectives of providing citizens with access to their own health data, also across borders. And obviously, with this also reducing inequalities, what was just mentioned before. Secondly, to empower citizens to control their own personal data. But what for? It's exactly for this, to engage in self-care, to strengthen personal responsibility, to better glucose management, if we want so. And then there is the very important aspect of the secondary use of health data. And this is making this data available for research, making it available to better understand the disease, but also to exploit really the potential of digital tools, of combining data with the novel analytics that we have, like artificial intelligence, like advanced data analytics, and the high performance computing that we put in place. I mean, we are now in a situation where we can use and should harvest the combination of tools and data to the extent possible. And actually, in this extent, the Commission has moved quite a bit forward. On the data side, you notice about a year ago, the data strategy was published. And as a follow-up, with more, let's say, with a more clearer view on the regulatory part, the Data Governance Act was published a couple of months ago, I think in November 2020. And of the 9 specific and sectoral data spaces that are mentioned in the data strategy, the European health data space has been given a priority also. And this contains as much of things on 2 components. It has certainly a physical part on interoperability, but in particular, it has to put in place a regulatory framework to enhance and increase trust, to respect data privacy. And also on the use of digital tools, I think the same applies. Is we need a trust framework, for example, as concerns artificial intelligence, the use of artificial intelligence for diagnosis in order to make it useful for clinicians, but also for patients. And in this context, the European strategy on AI, on artificial intelligence, tackles these 3 parts. Obviously, there's an industrial component, and Europe does not want to lag behind. But there is also the component to prepare society for the socioeconomic changes, and we need to put in place an ethical and regulatory framework. Now, I think the tools that we have, the different projects, were very well summarized by Christian Bouchoy, like the Digital Health Europe program, the EU for Health, also the research programs, and there has been actually quite a support to research on diabetes, also in the FP7 and H2020 research programs. I would probably also like to mention that under the RRF, the Recovery and Resilience facilities, there's a quite large share from member states reserved to support the digital transformation in countries, which also includes health. And just to give one concrete example, we have financed dozens, if not to say hundreds, of research projects. I'd just like to mention Power2DM. That is something that is really, it's a tool that harvests your personal data. It's a tool that that really has quite a number of interesting data analytics, but the most important part, it also has an e-coaching component, and it helps the patient affected to go for a better glucose management. And I think when we really look at the outcome of the research projects, this is very promising. Thank you very much.
Thank you, Tobias. It seems your colleague Jonna from the DG Santé is not able to connect right now, but we'll move on. I'd like to bring in Marisa Matias, MEP from Portugal. Marisa, I understand you're also a candidate to the Portuguese presidential elections. So I would really like to know from your perspective, listening to this also as a potential person who will be in charge of implementing this on a national level. How does this resonate? What do you see as the biggest challenges maybe? What's your comment to this blueprint? And you're still on mute, Marisa, sorry. Thank you.
Okay, I was still muted, I'm sorry. First of all, I want to thank, I already had the chance to say that this blueprint is really important and is really useful for our activities in the European Parliament. And I think it is both useful at the European level and national level, for sure, because recommendations have implications in both sides. But honestly, I'd like to say that I'm afraid that we have too many fragmented approaches. And the fact that we have too many fragmented approaches does not enable us to have a central core in a common approach, and especially helping the cooperation between the national level and the European level. At the same time, we have good opportunities to develop and to try to fight these challenges now. Because of the COVID-19, we started to see that we need the European Union for Health, and not entering into the national and in the member states' competencies. There's a lot of work to do at European level in terms of cooperation, not only because of the crisis and the COVID crisis specifically, but especially in areas like the non-communicable diseases and public health, because that's something that we should take as a competence in order to influence both the national and European level when it comes for action. Additionally, we also have the European Union for Health, like my colleague Christian just spoke about. And there's also an emphasis of trying to articulate the European level and the national level when it comes to non-communicable diseases and when it comes to diabetes, and also to promote the actions and action plans in the member states in order to prevent diabetes. That's quite clear in the EU for Health. And finally, we also have this opportunity with the recovery and resilience funds, and as it was just said before, there are some targets in it, and 20% of it has to be devoted to the digital transition. And the only way I think to be correctly applied is if we see this digital transition in link with the concrete problems that we are facing. And I think is a good opportunity at this health level and public health and non-communicable diseases to put into practice several projects that were not able to see the light of the day until now. I didn't answer properly to your question, but in any case, I want to say that in these domains, I only see we having the capacity to move forward if we really assume that we have joint tasks and without interfering in the national strategies, we can have a common cooperation that will enhance the national strategies and our capacity to answer to these issues. So that's how I see things. And I hope that with this blueprint and the capacity of putting concrete actions and proposals in these new instruments, the Union for Health, the EU for Health, the European Health Union, the EU for Health, the Recovery and Resilience Funds, and all these areas, I hope that we can do differently from before, and especially try to concentrate in doing joint things and not still with fragmented programs and policies, which then makes how are all aims being lost, and especially the ones related with non-communicable diseases, public health, and specifically diabetes? Thank you.
Marisa, thank you very much. And I couldn't agree more. There is a fragmentation and we need a more unified voice, both from the patient side as well as on the political level. Otherwise, we're just going to do pilot projects here and there. So it's great to see all of the MEPs coming together in this MEP interest group to push together with a common agenda. But then again, this is also something the reality we live with. Implementation does happen in health policy mostly on the national level. So we thought we'd stick to Portugal for a second and also turn it back to the clinician side. And I would like to bring in João Raposo, who is the clinical director of the diabetes organization in Portugal. João, your comments on this, maybe from a national perspective.
Thank you, Bastian. It's great to be part of this launching day of the blueprint here from Portugal. And I fully agree with most of the things that have been said before. And up to this moment, the things I'm really afraid is to learn from our historical background. So the Portuguese Diabetes Association, as you know, it's the oldest diabetes association, and we have seen a lot of these initiatives taking place up to this moment. And so I think we should learn again, as you said, Bastian, we should not go for another pilot, for another study, but learn what happened before and what it did work and why it didn't work. Because we are always speaking about the numbers of diabetes, and Chantal said, well, we are not sure about the numbers, but of course we know that the numbers are huge and they represent a huge problem. And I think we should not discuss anymore exactly the number, because for COVID, we know, again, that's a pandemic. We are still struggling with this concept of pandemic. We have been using that for diabetes for many, many years, and it didn't work at all. And for COVID, it worked. We see countries mobilizing, international organizations mobilizing at national level. Energy was put in place to fight the COVID pandemic. And for diabetes, what has been happening to this moment? Almost nothing. We are always speaking about curbing and flatten the curve, and still not working. Happening a lot. We still have struggling with that huge problem. So we should discuss why did countries not perceive the same value for diabetes and for non-communicable diseases as for a pandemic like COVID? Because diabetes really represents a threat to the economical situation of countries of the world. It kills a lot of people every year and still not working. So I think the patient involvement in this situation, it's a key factor. But again, it's the concept that WHO has published for many years. That's the concept of One Health, or health in every policy. Because if we want to reduce the risk for diabetes, as a good example for that, we have to have a changing of our society pattern. We have to change a lot of things in different roles. And again, putting the patients, people's associations, involving the community in this effort, I think would be the key element, the key enabler element to change. And this has been a little bit of the example of what happened here in Portugal with the Portuguese Diabetes Association and with the Portuguese Diabetes Society, and with the integration of all stakeholders in the process. Thank you, Bastian.
Thank you very much. And we're almost out of time, but as we started with such a strong focus on people living with diabetes, and this is also our role here as IDF Europe in supporting the MEP interest group on diabetes, I would hate to close without having that back. So Kaisa, if you could come back in with just 1 minute on how this whole thing, I know you've been involved in writing it and supporting us, but how does this resonate with you living with diabetes, and one thing that you would maybe focus on?
Thank you, Bastian. First of all, I'm so happy to have heard the other panelists. I think we're on a journey where also patient involvement has increased and the focus on that has increased. I'm so happy to hear this from the other panelists. Obviously, I'm a bit biased having contributed to the blueprint, but for me, it resonates well. I am so happy to see psychosocial support included. I am so happy to see a focus on access. I would like to see a little bit more on biosimilars perhaps, but access is so fundamental to what we do. I'm really happy as someone living with several NCDs to see integration of care being mentioned. like I said, meaningful engagement, that's something that the focus on that is increasing, not only from IDF Europe's side, but also WHO. The NCD Alliance has been working on this for ages. It's wonderful to see that. And that is helping also to change the narrative of diabetes. Strategically choosing what we say and who says it helps that. But that I really always have been passionate about, and I think it increased helping in the writing of this has been is the registries. When I interviewed the member associations and people living with diabetes for this, that was one of the things that they emphasized most heavily as being important. And being from Sweden and having been on the steering committee for the Swedish National Diabetes Registry, I've seen the huge value of that and the huge impact, not only for treatment outcomes and improving care, but also in facilitating research based on the data from the registries. And also, I mean, I've talked about this a lot, but also depending on the transparency of the registry. Oh, I don't know if it's oh, I think it's Bastian's niece. We're happy to hear that. No, but depending on the transparency, also how powerful it can be in advocacy and in policy work. I know in Sweden, we've used a lot of the data from the registries in data-driven advocacy, and the power of that is immense. I'm really happy to see that. Thank you.
It seems someone is not on mute in the call, but that happens. I'm terribly sorry that we're going a bit over time, but thank you very much, Kajsa, for these personal remarks, also from where it matters to people with diabetes, and I couldn't agree more. We were supposed to bring in Nebojsa Lalic, our vice president from IDF Europe as well, but I think we'll have to cut that. I would like to thank all the panelists for being here. Sorry for going a bit over time. I think this was a great contribution. Everybody in the audience, please do take the time to download the report, take a look at the key recommendations and the key enablers. It's a very quick read if you want, it's a long read if you have the time, but it is really worth it, and it brings together all these great voices we've had here on the panel and in the presentations. And with that, I would like to hand over to Sirpa Pietikainen, who is the second co-chair together with Crystal Schaltemose of the MEP interest group in diabetes in the European Parliament, for her closing remarks. Sirpa, thank you very much for joining.
Thank you, and thank you for all of you organizing this event, the wonderful work for the blueprint, the interesting presentations, and the panel indeed. I think it is time to bring up the diabetes, or as I want to say it in plural, because there are different forms of diabetes, up to 23rd generation, and the age of the future. With digitalization, with benefiting the European EU for Health program, with the new genomic research, with personalized medicine and all that. But to do that, we need firstly the patient-oriented approach. That is the key, because this is why we do it. We need the specialist, the research, and we need more European Union. This is not a task that any of our member states or any of these politicians or patient organizations could do by themselves. So I'm very grateful to be part of this initiative and policy movement in the European Parliament to support this very complete blueprint, the roadmap, to really put the center to diabetes diseases, what it deserves, and take step by step the concrete actions on the healthcare, on prevention, and all the other fields that we have already discussed. So I'm looking forward working very closely with you in the future in different issues and in different meetings. Once again, thank you very much for your efforts. Let's see in upcoming meetings, and have a very nice spring, so because I believe it is even here in the north.
Sirpa, thank you very much. And with that, again, on behalf of IDF Europe, on behalf of the MEP interest group, thank you very much for joining. Thank you very much for contributing to this great panel discussion. Thank you very much to everyone in the audience for contributing, listening. Please, as I just wrote in the chat once again, send us your questions, comments, food for thought. We will make sure we will condense that and bring it into this interest group, because we will, of course, continue to work on concepts and papers like these, and we will bring them to you in the near future. Thank you very much. Have a wonderful day. Bye-bye.